Today we are stepping behind the polished floors, starched uniforms, clipped voices, and quiet rules of the 1950s hospital. Because if you have been watching British hospital stories and then looking at American ones, the words can become confusing very quickly. In Britain, we hear titles like consultant, registrar, house officer, matron, and ward sister. In America, especially in the 1950s, the words were different. But the truth underneath was very familiar. The hospital still had a ladder. It still had power. It still had people at the top, people in the middle, and people expected to obey without question. So before we start telling more American hospital stories, we need to understand the language of authority. In a British hospital, a senior doctor like Mr. Justice, the consultant, would not have been called Mr. Justice in America. In the American hospital world, he would most likely have been called Dr. Justice, and his role would be closest to an attending physician, or if he was a surgeon, an attending surgeon. The attending was the senior doctor responsible for the patient's care. He was the one the junior doctors looked to. He was the one whose decisions carried weight. He was the one who could walk onto a ward and change the atmosphere without raising his voice. In Britain, especially among surgeons, the title Mr. could show senior status, but in America, even the senior surgeons were usually called doctor. So our British Mr. Justice becomes Dr. Justice, the attending surgeon, or Dr. Justice, the senior attending physician. Under him, the British registrar would be closest to an American resident, and in some cases, a senior resident or chief resident. This was a doctor who had already qualified but was still training in the hospital system. He was not a medical student. He was not simply observing. He was working, examining patients, writing notes, following orders, making decisions within limits, and carrying a great deal of the day-to-day burden. The resident was often the doctor the nurses saw again and again on the ward. He might be tired, overworked, ambitious, nervous, arrogant, kind, careless, brilliant, or all of those things before breakfast. Under the resident came the intern, which was the closest American equivalent to the British house officer or junior doctor. The intern was newly qualified, still learning the rhythm of hospital life, and often thrown into long hours, late nights, bleeps, mistakes, pressure, and correction. The intern had a medical degree, but in the hospital hierarchy, he was still low down the ladder. He had authority over patients in some ways, but very little authority over the system itself. He answered to residents. Residents answered to attendings, and everybody knew it. Now, when we move across to nursing, the words change again. The British matron is one of the strongest images in 1950s hospital life. Matron was not just a job title. Matron represented discipline, order, uniform standards, cleanliness, moral authority, and the old idea that a hospital ward should run like a tight ship. In America, the closest equivalent would usually be the superintendent of nurses, or later the director of nursing, depending on the hospital and period. But she was not always the same as the British matron in cultural feeling. British matron had an almost legendary power in the ward imagination. In America, the superintendent of nurses could still be very powerful, but the structure was often more administrative, especially in larger hospitals. She oversaw nursing standards, staffing, training, discipline, and the general running of the nursing service. Beneath her, the British ward sister would be closest to the American head nurse, or charge nurse. And this is where the real ward life happened. The head nurse was the woman who knew the ward. She knew which patient was fading before the doctor noticed. She knew which intern was too tired to think clearly. She knew which family needed firm kindness, which student nurse needed encouragement, and which rule could not be bent. Officially, the doctors had the medical authority, but on the floor, the head nurse often held the practical knowledge that kept the ward alive. She controlled the routine. She controlled the standards. She controlled the rhythm of the shift. In many ways, she was the queen of the ward, but not always recognized as such by the men above her. Then came the registered nurses, the staff nurses, the student nurses, the orderlies, the attendants, the cleaners, the porters, the kitchen staff, and everyone else who made the hospital function. And this is where the unspoken hierarchy becomes important, because a 1950s hospital was not just a place of healing. It was a place of rank. People knew who could speak first, who had to wait, who could challenge, who had to smile, who could sit at the desk, who had to stand back, who was called doctor, who was called nurse, and who was barely called by their name at all. The attending physician stood at the top of the medical ladder. The resident stood beneath him. The intern stood beneath the resident. Nurses were expected to support the doctors, carry out instructions, observe patients, maintain order, and often catch mistakes without publicly embarrassing the doctor who made them. That was one of the great tensions of hospital life. Nurses saw everything. They knew more than they were always allowed to say. They could be highly skilled, deeply experienced, and absolutely essential, yet still expected to remain polite, deferential, and controlled. A nurse could save a patient by noticing a tiny change, but the formal praise might go elsewhere. A head nurse might prevent chaos every day, but the hospital story would still often center around the doctor. That was the system. Not always fair, not always spoken, but very real. In America, there was another layer too: race. In many 1950s hospitals, especially before the full force of civil rights changes, black nurses, black patients, and black staff often faced exclusion, segregation, lower status, fewer opportunities, and quiet or open discrimination. A black nurse might have the same intelligence, the same care, the same discipline, and the same skill as a white nurse, but still be blocked from certain roles, certain hospitals, certain training paths, or certain kinds of respect. She might be expected to serve, but not lead. She might be trusted with the hardest work, but not given the title. That matters. Because when we tell 1950s hospital stories, we cannot just admire the uniforms and the polished floors. We have to see the human cost inside the system. Gender mattered, race mattered, class mattered, accent mattered, education mattered, obedience mattered, and silence was often treated as professionalism. The rules were not only written in policy books, they were written in glances, tone of voice, seating arrangements, ward routines, and who was allowed to correct whom. A junior doctor could be exhausted and still outrank a nurse with 20 years of experience. A head nurse could quietly guide a young doctor through a crisis, but he might still be the one expected to speak to the senior attending. A student nurse could be corrected sharply for a crooked cap, a late tray, a smudged shoe, or a badly folded sheet because discipline was seen as part of nursing character. The uniform was not just clothing, it was a signal of rank. The cap, the apron, the badge, the shoes, the way a nurse carried herself, all of it told the hospital where she belonged. In Britain, matron watched. In America, the superintendent, director of nursing, head nurse, or charge nurse watched. Different words, same pressure. And this is why we need to explain the terminology before we simply remake British hospital stories as American ones. If we just swap names, we miss the deeper truth. A British consultant is not exactly the same as an American attending, but they occupy a similar position of senior medical authority. A British registrar is not exactly the same as an American resident, but both are doctors in serious hospital training. A British house officer is close to an American intern or junior resident, newly qualified and still finding his footing. A British matron is closest to a superintendent of nurses or director of nursing, but the feeling of the role is not identical. A British ward sister is closest to an American head nurse or charge nurse, the woman who holds the ward together while everyone else thinks they are in charge. So when we later meet our American characters, we will not just be changing costumes or accents. We will be stepping into a different hospital language. Mr. Justice becomes Dr. Justice, the senior attending. Mr. Mason, the registrar, may become Dr. Mason, the senior resident or chief resident. Mr. Prescott, the junior doctor, may become Dr. Prescott, the intern. Matron Hattie may become Miss Hattie, superintendent of nurses, or Mrs. Hattie, director of nursing. Nurse Patty's American equivalent might be a staff nurse, a head nurse, or a charge nurse, depending on the story. And Annie's American story may carry an even deeper truth, because for a black nurse in the 1950s, the hospital hierarchy was not only about training and rank. It was about having to prove competence in a system that often decided who mattered before she even entered the room. That is why this history is important. These were not just job titles. They were signals of power. They told people who could command, who could question, who could be believed, and who had to survive quietly while doing the real work. So the next time you hear the word consultant in a British hospital story, think senior attending in America. When you hear registrar, think resident or chief resident. When you hear house officer, think intern. When you hear matron, think superintendent of nurses or director of nursing. But remember that matron carried a very British kind of authority. And when you hear ward sister, think head nurse or charge nurse, the person who often knew the ward better than anyone else. The words were different, the uniforms were different, the accents were different, but the hierarchy was there on both sides of the Atlantic. And in the 1950s hospital, hierarchy was not background decoration. It was the air everyone breathed.